The purpose of the project is for the nursing students to investigate evidence-based practice to find interventions that are effective in minimizing the formation of pressure ulcers. The students narrowed the patient population to long-term care setting that evolved into our clinical question. Our clinical question is, what are effective nursing interventions to minimize pressure ulcer formation in long-term care patients? So the significance of the problem. On average, 30% of patients admitted to acute and long-term settings will develop or are affected by pressure ulcers. The prevalence rates increased to 7.75% to 83% in nursing home settings, compared to 4.7% to 22.9% in hospitals.
The process of literature search was done electronically through the Cressman Library at Cedar Crest College. The databases used to perform the search were PubMed Central, Google Scholar, Sage, EBSCOhost, and Wiley Online Library. The keywords used in the searches were pressure ulcers, prevention, interventions, pressure ulcer healing, zinc complex, nutrition, and pressure ulcer incidence. The searches yielded from 28 to 1,783 results. These results were then limited by looking for results that were published from 2008 to the present, that were full text available, quantitative, and peer-reviewed. The 5 articles were ultimately chosen to best answer our questions.
A study done by Seiki et al. Determined the effects of L-carcinoin, or CAR, and its zinc complex, PLZ, on ulcer healing. The design was quantitative, non-randomized controlled trial. It had 42 patients with stages 1 through 4 pressure ulcers. The setting was Washio Hospital, which is a geriatric facility. The variables were the dosage of CAR and PLZ along with the patients. The limitations were that the study had a small sample size, it was non-randomized and non-blinded.
The next study that was examined was a quantitative retrospective case control study that evaluated the use of the Braden scale on an intensive care unit. 715 patients were chosen to participate in a South Korean hospital intensive care unit. Length of hospital stay of the patients were the variables that were looked at. Inaccurate documentation, and there was a weak link in the Braden scale and nursing interventions. The next study that was reviewed was a quantitative pre-post quasi-experimental design examining comprehensive nutritional interventions on pressure ulcer healing and length of hospital stay. 100 patients were chosen with a 50 patient control group and 50 experimental patients. It took place in an acute long-term care facility in South Florida, and the nutritional assessments, the use of an interdisciplinary team was the variable for this study. Differences of race and ethnicity, only stage 2 and 3 ulcers were studied, was the limitations. Peterson et al. Did the next study, evaluated current repositioning interventions using pressure mapping to measure pressure on at-risk skin tissue of long-term care patients. This was a quantitative study, descriptive observational design. 23 patients, intensive care had 20 patients, and intermediate care had 3 patients. That was performed at a tertiary care university affiliated hospital. The variable amounts of pressure on at-risk tissues was the variable in this case. The 2 limitations were do not directly measure internal or capillary pressures. The second was improper patient positioning on the sensors could have been a problem.
In the study by Messian et al., the researchers utilized a prospective multi-center randomized controlled trial to investigate the effectiveness of the Australian medical sheepskin in the prevention of sacral ulcers. This study was done amongst 8 nursing homes in the Netherlands. 543 patients yielded results in this study. 272 were from the control group, in which the patients were treated with the standard skin care, and 271 were from the experimental group, in which the patients were treated with standard skin care and had a bedliner made of the Australian medical sheepskin. The variable in this study was the amount of time spent on the Australian medical sheepskin by the patients. The limitations in this study was that it was non-blinded, and that the actual amount of time on the Australian medical sheepskin was not recorded.
Recommendations for practice would be to integrate the additional nursing interventions that were researched. These nursing interventions have increased rates of success for minimizing pressure ulcer formation in long-term care patients. The first recommendation is to monitor patient nutrition, which will lead to shorter hospital stays and minimize pressure ulcer formation. The second recommendation is to supplement L-carnosine and the zinc complex, which will help limit the progression of pressure ulcer formation. The third recommendation would be proper and increased use of the Braden scale, which will make nurses more aware of that risk skin tissue. The fourth recommendation is that further research and education using pressure mapping techniques is needed to improve repositioning techniques. And the fifth recommendation is the use of Australian medical sheepskin will reduce sacral pressure in long-term care patients.
The conclusion was the nursing students investigated that evidence-based research identifies proper interventions with high statistics of success, suggesting different ways nurses can provide interventions to patients with pressure ulcers, incorporating proper nutrition, positioning, proper use of the Braden scale, oral CAR and PLZ, and the Australian medical sheepskin.